Hi, I'm Dr. Deepti Jain, and I'm a spine surgeon. I have done thousands of spine surgeries in my career. I get asked a lot about microdiscectomy, so let's talk about it. What is a microdiscectomy? And is it as easy as everyone says it is? So a microdiscectomy is a relatively small spine surgery. Now, I use the word relatively because in my opinion, actually, there is no such thing as a small spine surgery. The consequences of spine surgery, no matter how long it takes or no matter how small the incision is, can be really life-changing in both a positive and negative way. And if there's a complication, that complication can go really badly. And so I really hesitate to use the word small surgery because there's no such thing as a small spine surgery. However, on the spectrum of spine surgeries, it's a smaller procedure. So when I do a microdiscectomy, I perform it minimally invasively, where essentially what I do is I put down a dilator onto the back of the spine. So if this is the spine, I put a dilator onto the spine. I then put a tube that's about 20 millimeters. That goes directly onto the spine itself. I then shave away the bone and I move the nerve roots out of the way and pluck out that disc herniation. Now that is definitely an oversimplified way. So importantly, the nerves are in a sac of fluid, and that is called the thecal sac. And that sac is tissue paper-like. And so sometimes that sac can leak during surgery. If that leaks, it can be repaired during surgery and the patient goes on with no subsequent consequence, but sometimes it can persistently leak and that can pose downstream problems. But in general, that is what a microdiscectomy is, and the whole procedure takes about 30 minutes. So it's a pretty quick procedure. And in general, this surgery is for a disc herniation. That's when there's a disc that's pinching a nerve. And so patients often do feel better much quicker. I'm Dr. Deepti Jain. If you like what you're hearing, hit the like button and also subscribe. And we deliver new information about neck and back pain every day.